Hey guys, Dr. Adam Miller here, and I want to welcome you to Arise MD again. Today we're talking about the human heart, and it's continuing our series here on whether or not we should be spending $100 to $200 on wearables, and what are they really doing for us other than looking cool and making us feel like we're with the in crowd. Well, wearables are here and they're here to stay, and they have a very important role in what we call biofeedback. So I'm going to give you some basic cardiology today and tell you how you can use a wearable device like this FitBit Blaze to potentially save your life. Let's start, as we do with anything at Arise MD, by talking about human anatomy, God's design for the human heart. Remember, cardiovascular disease is the #1 killer in America, and it's been that way for a long, long time. But here's two facts that are even more disturbing. One is that those who have a heart attack today, half of them are finding out in the emergency room when they're being told that they're having a heart attack that they have cardiovascular disease. Hey, you just had an MI and I guess you didn't know you had cardiovascular disease. That's pretty scary. The second part is that half the people who find out they have cardiovascular disease, they had the top 5 risk factors for coronary artery disease controlled. So the traditional system hasn't done a great job of surveying or surveillance for the #1 killer. Just hasn't. And I think it's time in this new era of medicine to have more patient empowerment. And so let's talk about self-assessment and the use of wearables for biofeedback, all right? First, anatomy. I'm going to make it really simple here. The heart's broken into 4 chambers. We've got 2 atria, they're called, on the top, and we have 2 ventricles on the bottom. Remember, the heart sits here on the left side. It's about the size of a human fist, and it's the left ventricle, this guy over here, that's real thick and does most of the work in pumping out oxygenated blood to the rest of the system. Well, we all know that resting heart rate is something we're supposed to be watching for. We've heard about how Lance Armstrong had a resting heart rate of 40 or less. And generally speaking, yeah, a low heart rate, if it isn't pathologic, meaning you don't have a bradyarrhythmia, we say, is a very good thing. It means that your system is adapted to have maintained decent blood pressure to support your kidneys, support your brain, support your liver, without needing a real high heart rate, okay? So the anatomy is atria and ventricles. The ventricles where the action is. But what about the heart rate? What determines the human heart rate? Right now, if I check my Fitbit, I see my resting heart rate this morning was 60 when I woke up. My heart rate right now, as I'm speaking to you and getting kind of excited about this topic, is 80 beats per minute. Well, very interestingly, the human heart has an electrical conduction system in it. It has its own nervous system. This is why you can pick up on an EKG, the squiggle lines. All those leads are doing is picking up an electrical signal that's traversing your heart. That signal starts in what we call the lead built-in pacemaker, the sinoatrial node. That's a little piece of tissue, nervous tissue, in the upper right atrium, and it is set to have the heartbeat at about 100 beats per minute. But most of us don't have a resting heart rate of 100 beats per minute, do we? I'm going to tell you why. If for some reason the SA node would fail, and in some people it does, it's a disease, they have SA node sickness, then the AV node is our backup pacemaker system that kicks in. That guy wants to beat it about 70 beats per minute. A little more reasonable, don't you think? And then if for some reason the AV node is sick as well, then these things called Purkinje fibers want to kick in, and they will pace the heart between 30 and 40 beats per minute. At 30 to 40 beats per minute, you are not going to be able to run very far if you are trying to survive a bear attack or get away from that tiger or deal with your boss on a Monday morning. So why isn't our resting heart rate set at 100 if that SA node is set at 100? And the reason is we have this rest nervous system and this fight or flight nervous system in a balance. It's called the parasympathetic or rest nervous system, and the sympathetic or strike or fight nervous system, working constantly, even as I'm speaking right now, to send messages to the heart and the rest of the body about the state of stress, the state of need. The problem for most of us guys, as you know, is that we're under stress. We don't do a great job of sending our body rest signals, do we? There's bills to pay, there's relationships to maintain, there are patients to take care of, there's things to fix. Our jobs are very demanding. And by the way, the environment continues to be less and less friendly for rest. We are overstimulated and more toxins are being pumped into the environment. In a healthy individual, that parasympathetic or rest nervous system is sending a signal, a tonal signal throughout the day to help keep that SA node in check. Think of that bucking bronco and that parasympathetic nervous system being the force that pulls on the reins and says, easy boy, easy, come back here. Or think of it as the brake, okay? On your car that pushes down to slow the progression. Most of us are not getting enough parasympathetic activity or signaling throughout the day. And when that happens, then the brake comes off. The SA node is allowed to have a little more influence on the system, and we see higher resting heart rates. Got it? So in the absence of sending signals, which can be just the way you're perceiving the day, the way you're holding yourself, the way you're breathing, the SA node is going to take over and nudge its way in, and it's going to run that heart at a high heart rate. So what can you do? Well, that takes us back to the wearables. I can use this. Whoa, my heart rate's now jumped up to 90 beats per minute. I'm going to take a few more deep breaths, okay? And I'm going to use this heart rate as I'm doing deep diaphragmatic breathing to breathe down my heart rate. In other words, to turn on the parasympathetic nervous system. And it's a very slick way that this happens. As I breathe, do deep belly breathing, expand my diaphragm, a nerve called the vagus nerve is activated, which brings more tone to the parasympathetic or rest nervous system and drives down the heart rate. That should be easy to remember. The VEGAS nervous system is more along the lines of sympathetic, right? If you're in Vegas, you're pretty high strung, you're pretty high energy, and your stress nervous system is cranked way up. This is the VAGUS nerve, okay? And that is activated when you expand your diaphragm, and it helps turn up the parasympathetic tone. In other words, it helps increase the brake on the heart. What other things other than deep belly breathing? Taking a hot Epsom salts bath, meditating, listening to some very relaxing music, smelling some lavender or other relaxing scents, having a wonderful conversation with somebody, eating a little bit of savory food, telling somebody that you love them or doing something nice. All of these things are going to help push that parasympathetic breakdown and slow your heart rate by resetting or calibrating the autonomic nervous system, the parasympathetic nervous system. All right? Now, as we always do at Arise MD, we want to ask, why would God design the system like this? And there's a very good explanation. In this arrangement, if I, as a human being with free will, break my rest nervous system, the heart's going to be out of the barn, and it'll run at 100 beats per minute, which, when we look at this equation of cardiovascular physiology, we realize that the heart rate is directly linked to the blood pressure. So with a higher heart rate, I'm going to have enough blood pressure to fuel my kidneys, my muscles, my brain, and my heart to run away from an attacker, to run away from a lion, or to run towards somebody who's trying to steal my child. So we have this built-in system with a higher heart rate so that we have adequate blood pressure to survive. If it was just the opposite, if the SA node was set to only beat at 40 to 50 beats per minute, and the human being with free will wrecks the sympathetic nervous system so that you can't flog it and tell it to get going, then you are going to have a low heart rate, you're going to have low blood pressure, and you're not going to be able to go very far. There's just no get up and go to get away from danger. Make sense? I hope so. The wearables. We're finding that this FitBit Blaze is quite accurate. It got a little bit of a lag when we get up to a high heart rate on the treadmill, but generally speaking, it's pretty accurate, and they're so convenient. And what we do, our clients, is at 2 p.m. each day, we do 2 minutes of deep belly breathing to push the brake down by activating the parasympathetic nervous system, on the SA node, and hopefully giving us a resting heart rate continually less than 70 beats per minute, which is that safe zone in cardiovascular medicine. Well, we're always excited to study God's design for the human body and dive into physiology at Arise MD. Hopefully today you understand why using a wearable like this to monitor your resting heart rate can help control the heart rate on a day-to-day basis, help manage blood pressure, and hopefully help keep you from being one of the many millions of Americans who are having heart attacks each day. I'm Dr. Adam Miller, founder of Arise MD. There'll be many more segments like this. If you have questions, feel free to send me an email at dradammiller@gmail.com, or you can send us an inquiry at arisemd.com. Take care and God bless.